Episode 56, JV, October 12, 2023. Reduce company profit margins for Wisconsin electric grid expansion. Wildfire and NYC Asthma. Wisconsin. Electric grid expansion. Capital Times newsletter, October 12, 2023. https://captimescom/news/government/who gets to build Wisconsin's energy future lawmakers to decide /article_DAECFCCBHTML excerpts edited by Rozep for brevity and clarity and relationship to residents against Wood Smoke Emission Particulates Corporation, a nonprofit organization. Why not a bill to just reduce profit margins for any utility company in Wisconsin? The right of first refusal versus the lowest bidder system in Wisconsin is being debated in the Wisconsin state legislature this week. Proponents of Wisconsin right of first refusal argue that local utilities know their service area the best and can provide better service than their out-of-state counterparts at a key time for the electric grid. Wisconsin will see at least $2 billion worth of transmission lines built over the next decade, under a $10 billion blueprint approved by the regional electric grid that covers the upper Midwest, called the Mid-Continent Independent System Operator. For now, those projects can be farmed out to the lowest bidder. But more states are requiring that utilities near where the lines are set to be built get first crack at their construction. The parties interested in the fate of right of first refusal in Wisconsin in regard to building of transmission lines in Wisconsin are: 1. Consumers worried about costs, short term, may be for or against right of first refusal. Consumers have floated a proposal that companies instead reduce profit margins by Wisconsin imposing a cap on profits. Local utility costs to consumers are going up. The timing for pushing a bill allowing right of first refusal in favor of local utilities is particularly poor, as the state's largest utilities, notably Xcel Energy, MGE and Alliant Energy, are pushing for rate increases. Consumer advocates have pushed the Public Service Commission to instead reduce the profit margin for these firms. 2. The Citizens Utility Board, CUB, seems generally against right of first refusal when CUB advocates for Wisconsin ratepayers at least in the short term, fearing the legislation would be nothing more than the state government facilitating a monopoly for Wisconsin-based companies such as ATC or Xcel Energy, meaning consumers might not get the best deal. We should be looking for opportunities to save money for customers wherever we can, said the executive director of the Citizens Utility Board of Wisconsin, the independent body that advocates on behalf of Wisconsin ratepayers. What this bill does is it actually eliminates ways to save money by preventing competitive bidding. Critics maintain that the only end result of privileging in-state utilities is higher rates for consumers to subsidize construction. Critics point to caps on competitively bid projects that minimize how much ratepayers have to foot the bill for cost overruns. 3. Iowa and Illinois are against right of first refusal. In March, the Iowa Supreme Court blocked that state's right of first refusal law. While the ruling said the case against the law was likely to succeed, this was because of a technicality in how the bill was passed. Still, the justices blasted the idea as quintessentially crony capitalism. Illinois Governor J.B. Pritzker charged cronyism in vetoing his state's version of the bill in August, saying it was putting corporate profits over consumers. 4. Clean Wisconsin is for building more transmission lines, and thinks both in the long and short term about ratepayer costs for either system, first right of refusal or default lowest bidder. The Energy and Air Manager for Clean Wisconsin, a group that advocates to protect the state's natural resources, said consumers would benefit long term from more transmission lines. Those projects would ultimately pay for themselves 2 to 3 times over and help strengthen the grid's reliability across the region. But those gains shouldn't come at the expense of a short-term burden on consumers. We think a lot about the benefits that this investment is going to bring to Wisconsinites, but at the same time, we would like them to be cheaper. 5. Americans for Prosperity, AFP, seems to be against right to first refusal. Opposition to the right of first refusal bill is shared with conservative, free market groups like Americans for Prosperity, an influential backer of Republican lawmakers in the state capitol. AFP, founded in 2004. Is a libertarian conservative political advocacy group in the United States funded by Charles Koch and his brother David. As the Koch brothers' primary political advocacy group, it is one of the most influential American conservative organizations. AFP Wisconsin State Director told lawmakers that a lack of competition would give, out-of-state, companies little incentive to reduce the 10.52% profit margin they are allowed to recoup for transmission line projects. AFP seems to favor having out-of-state utility companies bid low and then later jack up prices if they would like. A conservative group opposed to right of first refusal laws published an analysis in August showing that Indiana's new law would cause transmission line costs in the state to swell by $127 million across the entire region. B1, local utility company, Xcel Energy announced plans Tuesday to begin building a $500 million power line. The exact route is unknown, but it would likely run from Blair in Trempealeau County to either Owen in Clark County or Sheldon in Rusk County. Of the $2 billion in Wisconsin projects announced by the regional grid operator last year, Xcel Energy is set to build out over half of that, executives said on an earnings call last year. Those projects all will require approval of state regulators and could be subject to legal challenges, much like a proposed line from Madison to the Iowa border that has been in limbo for years. And the trend is only set to continue, with a second batch of projects expected to be approved in 2024. B2. Minnesota, North and South Dakota, and Michigan are states choosing local utilities over lowest bidders by passing right of first refusal law. Efforts to enact a similar law in Wisconsin died last session. Now proponents are trying again, with hearings in both the Senate and Assembly this week. Proponents, including ATC, Xcel Energy, and a coalition of utilities including Madison Gas and Electric and Alliant Energy, argue the legislation is a way of ensuring Wisconsin stakeholders control the state's energy future. B3. A Wisconsin Republican state senator co-wrote the bill, the right of first refusal. Reasons given for the bill: delays in construction, and unrealistically low bids by out-of-state utilities, which ultimately will cost the ratepayers in the long term, after lowest bid is the defaulted to under the current system. B4. American Transmission Company is for right to first refusal. Without this legislation, Wisconsin will have no say over who gets to build out major projects on the grid, and the current outstanding safety and reliability performance of the system will be at risk, said the Executive Vice President and General Counsel for ATC. Wisconsin State Journal. October 12, 2023. Wisconsin will build an estimated $2 billion in transmission lines in the next decade to stabilize the power grid and move renewable energy more smoothly. As Andrew Ball reports, the construction boom has utilities facing off against clean energy supporters, free market groups, and consumer advocates over whether companies already operating in Wisconsin should get a leg up in the process. New York City, asthma cases and wildfire smoke. Canadian wildfire smoke linked to boost in NYC asthma cases, futurity. Both the fine particulate matter and the emergency room visits peaked on June 7. PM2.5 pollution has been shown to affect respiratory health. Canadian wildfire impact. The study, recently published in the Journal of the American Medical Association, found a stark association between Canadian wildfire smoke and increases in the number of people being seen for asthma-related symptoms in New York City emergency departments. Canadian wildfire smoke associated with increased asthma cases in NYC. October 5, 2023. Excerpts edited by ROSEP for brevity and clarity and relationship to Residents Against Wood Smoke Emission Particulates Corporation, a nonprofit organization. Findings illustrate how drifting wildfire smoke impacts people hundreds of miles away. With smoke from Canadian wildfires once again descending on the northeastern United States, residents of New England and New York are being urged to take precautions to protect their health. While the wildfire smoke is not expected to be as bad as the thick orange haze that permeated the skies over New York City and the New England states last June, a heightened risk for health problems remains, especially among those with certain respiratory conditions. A new study by researchers at the Yale School of Public Health confirms that harmful smoke from wildfires is capable of traveling great distances and can impact the health of people hundreds of miles away. The study in the Journal of the American Medical Association found a stark association between Canadian wildfire smoke and increases in the number of people being seen for asthma-related symptoms in New York City emergency departments. The research is unique because previous studies on the health impacts of wildfire smoke have focused on areas near the wildfires, but not the broader global regions affected by drifting smoke. Looking at data from June 2023, the researchers found there was a significant spike in ambient fine particulate matter, PM2.5, in the air over New York City during a smoke wave that dropped down from Canada over a 3-day period from June 6 to June 8. On the same days that the spike in PM2.5 pollution occurred over New York, emergency department visits for asthma-related symptoms jumped to 261 per day across the city, compared with an average of about 182 visits per day during reference periods identified by the researchers before and after the smoke wave. Both the fine particulate matter and the emergency room visits peaked on June 7. PM2.5 pollution has been shown to affect respiratory health, cardiovascular health, birth outcomes, and mental health, said the study's lead author. The lead author and his team defined a wildfire smoke wave as a period of at least 2 consecutive days where the daily mean level of PM2.5 particulate matter exceeded the maximum level, 56.8 micrograms per cubic meter, G/M3, during a baseline period between January 2021 and May 2023. The daily mean level of PM2.5 pollution from June 6 to June 8 was 100.9 micrograms per cubic meter, compared with only 9 micrograms per cubic meter during the reference period. The researchers also looked at how the wildfire smoke impacted subgroups in New York City, separating and analyzing data by borough, Bronx, Brooklyn, Manhattan, Queens, and Staten Island, and by age, 0 to 4, 5 to 17, 18 to 64, and 65 and over. They found that all boroughs of New York City were impacted by the June smoke wave. All age groups were also affected by the wildfire smoke, but data revealed that people between the ages of 18 and 64 were most likely to visit the emergency department for asthma-related conditions during that time. Co-authors on the study were Yale School of Public Health, the Yale School of the Environment, and the Department of Epidemiology at Columbia University School of Public Health. Texas, PM2.5 and lung cancer. Dr. Ajad Shashadri emphasizes the necessity of obtaining updated data for lung cancer. American Journal of Managed Care. Up to 8.9 million premature deaths per year are attributable to PM less than 2.5 microns in diameter, PM2.5, and this ultrafine pollution is an associate professor of pulmonary medicine at the University of Texas MD Anderson Cancer Center, says that lung screening improvements and the implementation of race-neutral guidelines are crucial to keep in mind for future progress in pulmonary health. Excerpts edited by Rozep for brevity and clarity and relationship to Residents Against Wood Smoke Emission Particulates Corporation, a nonprofit organization. Transcript. What do you hope will happen between CHEST 2023 and CHEST 2024 in terms of how disparities in lung health care are addressed? I think there's a delay in getting cancer care. That includes some folks presenting with a later stage, and there is a need for more effective and more available screening, race-neutral guidelines, as well as a critical re-examination of the existing data to understand what are the actual thresholds using race-neutral guidelines that dictate whether someone is at low, medium, or high risk for pulmonary complications. That's something that may require more time for us to collect new data. These data probably needs to be collected anyway, because some of the data that influence the recommendations that have been made are many, many years old. It's also time for us to understand what the true risk is with modern surgical techniques and do it with this lens of looking at everybody without applying race corrections to their lung function values. Singapore, wildfire smoke. Wildfire smoke is a rising global challenge to clean air. One Green Planet. Excerpts edited by Rozep for brevity and clarity and relationship to Residents Against Wood Smoke Emission Particulates Corporation, a nonprofit organization. The smoke from these wildfires contains pollutants, notably PM2.5, tiny particles that infiltrate our lungs and bloodstream. Historically, the U.S. researchers in Singapore found that carbon monoxide from wildfire smoke could be both accelerating natural processes that produce methane and slowing those that remove it from the atmosphere, with much greater impact on global warming than previously thought. Colorado, Vail. Vail plans for pile burning as conditions permit to reduce wildfire hazards. VailDaily.com. Prescribed fire smoke may affect your health. For more information, visit colorado.gov/cdphe/wood-smoke-and-health. Anyone who may have health. Canada, British Columbia, Vavenby. Fire Prevention Week. A message from Blackpool Fire Rescue and Vavenby Fire Department. Clearwater time. Smoke and carbon monoxide. The more you have, especially near kitchens, furnaces, wood-burning stoves, dryers or other ignition sources, the better. Canada, Ontario, Newmarket. Key differences between a gas fireplace and gas fireplace. Insert Newmarket. Today, gas fireplaces can often be more cost-effective, practical, and environmentally friendly than wood-burning fireplaces. Ultimately, your choice of. Ecuador, Quito. Quito, Pichincha, Ecuador. Weather forecast and conditions. The Weather Channel. Delhi's PM10 and PM2.5 levels drop by over 40% in 9 years. Focus shifts to Winter Pollution Action Plan. Air pollution in the world's most. India, Delhi. Delhi and neighbors continue to be the most polluted in India and sometimes the world. India today. PM2.5 refers to particulate matter with a diameter of 2.5 microns, or roughly 1/30th of the width of a human hair strand. These minuscule India, Mumbai. Navi Mumbai, Urun tops air pollution charts. Greens fear severe health issues in Future Free Press Journal. Even on October 11, the PM2.5 and PM10 levels of Urun were 182 and 195, respectively. PM2.5 or particulate matter with a diameter of 2.5 Singapore. Haze situation update, October 11, 2023, NEA. As at 6 p.m., the 1-hour PM2.5 concentration readings were 13 to 28 micrograms per cubic meter, in band I, normal, and the 24-hour PSI was 56 to 81, in the moderate range. Update.